Hi, I'm Raymar B. Callado from Section Weidenbach. For this video, I will perform oral care for unconscious or debilitated patient. But first, what is oral care for unconscious or debilitated patient? A special care of the teeth, gums, lips, and tongue of the unconscious or debilitated patient.
For the assessment, assess the condition of the patient's oral cavity, teeth, gums, and mouth. Assess for color, lesions, tenderness, inflammation, intactness of the teeth, and degree of moisture or dryness of the oral cavity. Observe the external and internal lips. Assess the palate, roof, and floor of the mouth, and inspect under the tongue. Assess the entire oral mucosa, noting the inside of the nasopharyngeal area. Observe the tongue, note tip, sides, back position, and undersides. For the objectives, first to remove plaque and bacteria producing agents from the oral cavity. Second, to allow the nurse to assess the patient's oral health status, knowledge, and routine of the oral care. Third, to decrease the possibility of irritation or infection of the oral cavity and prevent sore formation. Fourth, to refresh and provide comfort to the patient. Fifth, to remove unpleasant taste and odors from the oral cavity, thereby preventing bad breath, halitosis. Sixth, to provide teaching when appropriate. For the equipment used for this procedure are gloves, toothbrush or sponge tooth or cotton applicator, tongue blade padded with a 4x4 gauze sponge, water, mouthwash, or hydrogen peroxide, towel, water-soluble lubricant for lips, suction catheter with suction apparatus, optional, emesis basin. Step 1. Gather the necessary supplies. Preparation promotes efficient time management and provides an organized approach to the task. Step 2. Explain the procedure. Explanations relieves anxiety and facilitates cooperation. Step 3. Perform hand hygiene and put on gloves. Hand hygiene deters the spread of microorganisms. Gloves prevent contact with microorganisms in the blood or saliva. Step 4. Close the curtain or door of the room. Closing the curtain or door protects the patient's privacy. Step 5. Raise the head to a comfortable height with the client's head tilted down. Proper positioning prevents back strain. Tilting the head downward encourages fluid to drain out of the client's mouth. Step 6. Place a towel and emesis basin under the client's chin. The towel protects the client. The emesis basin facilitates drainage from the client's mouth. Step 7. Open the client's mouth and insert the padded tongue blade toward the back molar area. Never insert your finger into the client's mouth. The tongue blade assists in keeping the client's mouth open. As a reflex mechanism, the clients may bite down if fingers are placed in his or her mouth. Step 8. Dip a tooth sponge, soft toothbrush, cotton applicator, or another padded tongue blade in water, mouthwash, or diluted hydrogen peroxide. Move it back and forth gently across the client's teeth and chewing areas. Cleanse the roof of the mouth and the inner cheek area. Friction cleanses the teeth. Cleaning solution aid in removing residue on the client's teeth and in softening encrusted areas. Step 9. Rinse the areas using a clean cotton applicator or padded tongue blade moistened in water. Rinsing removes cleaning solution and debris. Step 10. Apply water-soluble lubricant to the client's lips. Applying lubricant prevents lips from drying or cracking. Step 11. Reposition the client. Lower the bed and raise the side rail again. Repositioning with the bed at the proper height and side rails raise provides for the client's comfort and safety. Step 12. Remove gloves and wash your hands. Hand washing prevents spread of microorganisms. Step 13. Document assessments on the health record. Documentation provides communication and coordination of care.
For the evaluation, teeth are free of plaque, mucosa is moist, intact and has a uniform color, tongue is well hydrated as well as the lips are smooth and hydrated, bacteria producing agent is removed from the oral cavity thereby preventing halitosis, client experiences no oral discomfort.